if they get an attack, how they should respond, how they should react. Hello, welcome to Health Site. I am Dr. Mahavir Modi. I am a chest physician, pulmonologist working in Ruby Hall Clinic, Pune since last 22 years. Today's topic of discussion is about the asthma and to rule out these stigmas about asthma on the occasion of World Asthma Day, which is today 7th of May 2025. So many times we get patients, those who come to us with symptoms suggestive of asthma maybe for last 4, 5, 6, even sometimes 10 plus years. Or they had symptoms maybe sometimes in childhood, then they were okay and again the symptoms have started. So there is a lot of delay in the diagnosis, there is a lot of delay in the treatment, and the main reason for this is because people will feel that no, if I am labeled as asthma, this is something which is going to remain with me for years, and then I won't be able to get rid of my inhaler. So that is the main reason that this stigma causes the delayed diagnosis, and once the diagnosis is delayed, by the time patient comes to us, his airways are so much narrowed, they are so much rigid, they are so much plastic that even with the inhalers, they are difficult to open up. So then it becomes a very poor compliance to the treatment and the patient keeps on suffering even despite the inhalers. So we have to break this stigma and have early diagnosis, early treatment and better prognosis. So schools as well as the workplaces, sometimes they cause a stigma about these inhalers. Because what happens, suppose if you 10 people are going together and you are having lunch or dinner, and that time suppose somebody says that he's asthmatic or he had a heart issue. So people, they don't take them wrongly, but somebody starts using inhalers in a public place, then everybody will start feeling that, oh, he has bad asthma disease. And this basically happens even in children, okay, in the schools. So I think what is most important is for the parents as well as for the teachers to reinforce the diagnosis of asthma. They should have a written asthma action plan that in case if my son or my daughter in school or if at the workplace, if they get an attack, how they should respond, how they should react. Maybe in the emergency room in the school, there should be inhalers also available, and not the blue inhaler, but the pink inhaler, which should be made widely available. And one shouldn't afraid of these symptoms, but start treating them as early as possible and taking to the nearest medical center as early as possible. I think once the school and the teachers get convinced, as well as at the workplaces, if the bosses and the colleagues, if they get convinced, definitely it can decrease their stigma inside the schools as well as at the workplaces. So we understand asthma is basically it's a lifestyle disease. Okay, so one has to avoid certain triggers, what is causing this. So there is a lot of importance for the education about the awareness. More and more, especially women and children, if they start knowing what are the symptoms, what are the causes, what is causing the trigger, and then if they integrate this into their thinking process that okay, this is my enemy, this is if I do, then that is the reason I am getting an asthma attack. So it is not only the duty of that particular patient, but their surroundings, of their parents as well as from the in-laws also, because sometimes we observe that especially for the marriage age group also, the women, they always fear about using the inhalers, but we need to counsel them, and it has to be understood by the parents from both the sides that this is something which is not dangerous. It is just like any other disease, and it's just a lifestyle disease which patient has to identify the triggers and stay away from them. So healthcare provider, first they need to identify that this is asthma. For that they have to do certain tests like spirometry or maybe sometimes allergy tests or a chest x-ray, and they have to rule out that there is no other disease but this is asthma. Second thing is, when patient comes to us, they are too much confused. They have lots of do's and don'ts in their mind, that not to eat this, not to eat that, not to do this particular activity. So healthcare's first job is to relay or absolutely decrease the anxiety of the patient and their parents. Tell them that you are otherwise a normal individual, just you have to stick to their inhalers, you have to stick to your treatment and adhere with the not exposing yourself to the various triggers which are there. So once the patient gets this particular confidence, then I think from next time onwards in the subsequent follow-ups, the patient develops that trust with the doctor, and definitely it will increase the compliance of the patient.